Can you wear this
The whole
or no?
place is for you. Yeah, sure.
Would you like any refreshments? I just had some water. I'm good, thank you.
You just clip it on. There's a little clip. Have it in here.
All right. So you're a star person here. So we'll talk about something that's kind of unique for the mommy makeover stuff. So our whole point of talking about this was really about mommy makeovers, and I don't really like that term. You know, it kind of makes it sound kind of trivial, but it's more about body rejuvenation, and it's about really getting people back to where they once were without using the term mommy, because there are a lot of people who've actually just lost weight in their middle part of their lives, and they're just trying to sort of restore their anatomical prowess, both in their body, in their upper chest area, in their lower body wall area too. All those kind of things make a difference. So the way I look at this, and I'm a plastic surgeon, trained in general surgery first, and then plastic surgery up in Yale first, and Vanderbilt, and then I started practice here. I've only been here 20 years, 25 years actually. 25 years, 25 years yesterday.
He's only a researcher and scholar in this field.
Oh, please stop. But to get about the importance about really aesthetics for this, for body contouring, the whole purpose of this is to sort of recontour and lift the upper chest wall, tighten the belly wall area, remove sometimes extra heavy tissue that's there, fat left over, stretched out skin, contour the waistline in the back, the upper back sometimes, and do this in one go. Right. So while for a long time we tended not to do anything more than 4 or 5 hours, we still don't do that. But in the right person, you can actually reduce a lot of this and do the surgical procedure in less than 4.5 to 5 hours. So your recovery process is a lot quicker. The breasts obviously can get lifted. They can get augmented. Sometimes they need more of a reduction lift. Sometimes they just need a lift. Sometimes they need to be augmented and lifted. Augmentation happens with silicone implants. Even saline, although we tend not to use saline as much because their longevity is not as good as the silicone implants. And that gives a more natural contour and lift to the breast. It may be just an incision around the areola to the base of the breast. Sometimes it's all the way down and horizontal also. The tummy tuck involves removing skin and contouring the belly button. There's multiple different types of tummy tuck procedures. Probably the most common is a full tummy tuck where we make a new belly button, but we tighten the muscle and bring the two rectus muscles that are usually separated together. We stitch that layer first, then we do a secondary stitch into it, and then actually we're tightening the tissue below that area and making a new hole for the belly button. That's called a full abdominoplasty. Then there's a modified abdominoplasty where we're not necessarily cutting away the belly button, but we're actually leaving it attached because you don't need that much skin removed. And that makes a difference in contouring. The third type is just removing skin only, and some involves just a little bit of liposuction for people who are already fairly svelte and don't have that much, don't have any muscle laxity, they just have skin laxity. Especially with people on Wegovy and Ozempic and various and sundry GLPs, they've lost some volume, so that makes a big difference. And then the liposuction itself for the flank area is just removing fatty tissue in the upper back, mid back, lower back, wherever you can help attenuate and contour the waistline to a more youthful appearance. So you address the breast, then the abdomen, and then the flank area. Usually we start with whatever procedure we're doing first, which is usually liposuction, and then put you in a supine position when you're laying on your back, and then do the breast and the tummy appropriately. Downtime and recovery for this is usually about really just a few days. And when I say a few days, 7 to 10 days, that's probably, and as long as you're not over tightened and over cut and over liposuctioned, you get to a normal position in life, recovery is usually quite good. Usually a couple of days at most, and then that goes a long way.
Yeah, 4 to 10 days.
Tell us about your experience.
It was good. No, you can keep going.
No, so it's I think that I think that those are the important sort of parameters. It's not just about doing surgery, it's about doing the right surgery for the right person. Not everybody needs their breast lifted. Not everybody needs a full abdominoplasty. Not everybody needs liposuction. You find what it is that's really bothering you, and that can be improved, and that can make the difference, and that will give you the satisfaction you're looking for. And that really is what this is all about. Safely, of course. So even though we're doing everything in our outpatient surgical center, which is affiliated next door to our Ashburn office, we have anesthesia, we have everything set up for safe surgery. And we get you cleared by your primary care doctor first. Make sure you're not on any medications that put you at a little bit higher risk of aspiration, of wound healing issues, things like smoking, believe it or not. And many people vape. They just don't talk about it because they don't consider it, they're smoking. And that does increase your risk for wound healing complications and things of that nature. But we want to clear those beforehand. Make sense?
Is it outpatient?
It is outpatient. I think for what we're doing, as long as you're healthy, the ability to recover from anesthesia doesn't take that long, maybe 45 minutes or an hour. It's the way we use anesthesia by injecting anesthetic into the muscles to decrease any discomfort in the belly wall area and the chest wall area. That actually allows for you to get up and move around relatively with relative ease. And so you're moving around right away. We want you to move around. I usually see you the next day in the office, so I know you're walking because you have to walk into the office.
I was thinking about that.
And rather than being at home waiting a couple of days and then coming in, you're up moving around right away, and that really makes a huge impact on your recovery, so that you're up and you're back. Drains that we put in usually stay in between about 7 to 8 days, and when very little bit of fluid is coming out, we remove that completely. And the purpose being so that there's no extra fluid underneath the area of the skin and above the muscle, so that doesn't have any collection of fluid.
We only do surgery when you're surgical?
Yeah, so cosmetic surgery is no longer done at the hospital. Yeah, it's after COVID, the hospitals sort of have a problem with having enough staffing for their regular surgical procedures. So oral surgery, cosmetic surgery, cosmetic ENT rhinoplasty surgeries and plastic surgery rhinoplasties all got moved out. So in the state of Virginia, you will find very few places that are surgical facilities that allow cosmetic procedures. So most of us have to have our own surgical center that's certified by Quad A standards. So we've been doing surgery there for a number of years now, and we've been blessed to have a good, strong place with good staff.
If there's an emergency or something.
So usually our protocol for those kind of things are set up so that we have 911 availability, obviously. And you don't just have one person there. There's 5 of us there. So we don't leave you and take off, God forbid. We're there to make sure whatever challenges are. But the important point is to not have that problem to begin with, is to pick healthy people. If you have high risk of anything, then 2 things have to be thought of. Number 1 is maybe you're not the right candidate. And if it's a composite problem with something else, in those particular cases, we can sometimes do that at the hospital if there's something else going on. Like, for instance, a hernia. You can do a hernia surgery and a reconstructive surgery at the same time. But a straightforward cosmetic, you just can't do in the hospital system, at least in the northern part of Virginia. But there's always safety out there. There's issues with oxygenation. Transferring is a very important thing to Loudon Hospital, which is just down the street. It's important. And we're very cognizant of that. Other questions?
The cut, I believe it's right.
So we do a cut mostly along the lower aspect of the bikini line. The idea is where C-section cuts are. And you're familiar with people who've had C-sections?
I bet too.
It's the same line. We extend the C-section line up to the anterior superior iliac crest, which is basically the bone that you feel in the front. And it's not always to that level, but it's just enough so we can contour it appropriately so the waistline comes in nicely. We don't make them all the way around high going to the back. There are some people who need that because they're maybe a little bit on the heavier side or they have a wider pelvis. But in general, most people not. If you don't have a large heaviness of hangover, it's not that much of a challenge.
There's no cut here.
No, the people who have a sort of a vertical cut, that usually happens in significant weight loss patients. If you lose over 100, 120 pounds, there's a lot of skin not just hanging down, but also all around. Those people usually oftentimes need a full, what's called a circumferential belt abdominoplasty. And, but that's not the traditional torso elevation and tightening procedure. The muscles are stitched together. So typical muscles are straight up and down when you're a little bit younger. After you've had kids, the muscle above, just slightly above the belly button, stretches for the pelvis because kids are obviously in the pelvis. So it stretches that out significantly. and it doesn't quite come back in that area. The upper part of the muscle, usually working out, can do that, but the muscle on the sides causes a widening. It's called a diastasis. And I'm sure you Googled it and read about it. And so going in, we're not actually cutting into the muscle. We're tightening the lower part of the muscle and the upper muscle. We're literally stitching them together. And so since we're not inside the belly, that area in the muscle actually tightens up nicely. And so once that's intact, which is usually about the 4 or 5 week time period, by 6 weeks, you're able to do abdominal crunches and start working out slowly. It's not the easiest thing to do because you don't want to put too much tension and pressure. And if you remember from your C-section, I'm sure your gynecologist at the time and obstetrics doctor told you that nothing for 6 weeks. The reason is they're actually cutting into the muscle. We're not actually cutting into the muscle, but we want to have the same results. So we're solidifying and tightening and stitching the abdominal wall. And that actually makes a significant difference as far as bringing the muscle together. So that laxity you have is now taut. Those stitches are more permanent, but they're inside. The stitches along the skin line, those are dissolvable stitches. So there's nothing to take out except for the drain when we take the drain out.
Permanent stitches, they just stay in there forever.
Well, usually when you have any abdominal surgery, you want to have something that's strong. And dissolvable stitches aren't really strong, and especially if you need them 4 to 5 weeks to be strong, they start losing their tensile strength quickly once they're out. So you want something that has a little bit of more permanence. But they're deep in the tissue, so they don't have any effect other than keep the strength that's there.
Those are like I have titanium plates, so it's something like that.
Yeah, I mean titanium stays forever, and people don't have any reactivity to it, so it's those stitches are actually a little bit more. They're a little softer in nature. They're not obviously like titanium or vanadium or any of the other metallic stuff, but the dissolvable stitches dissolve within about usually 60 to 70 days.
So they will dissolve too? Oh, okay.
The dissolvable stitches will, yeah.
Okay.
Around the breast area.
They don't dissolve. I thought you said they
The ones in the muscle don't dissolve,
right.
yeah. But the ones under the skin level, they
Yeah,
dissolve.
yeah.
In the breast area, they dissolve. It's not much of a problem.
The ones on the muscle are meant to be inside.
Correct. Yeah, they're hidden. They're deep in the tissue. If you have orthopedic surgeries and hips, they use sutures that are a little bit stronger than that, so they actually give you the strength because it takes a while for the tissue to heal. If you use sutures and stitching that's weak, it becomes a problem. Good.
Do you have any questions for me? Do you have any questions for me? You want to hear about my experience or?
So your recovery first week was tough.
Yeah, it was tough. Just like he said, 7 to 10 days. Like, it was hard. The abdomen repair is probably it is the hardest part. For me, it was the hardest part. Now, I don't know about anybody else. I can only speak for myself, but that was definitely different than a C-section, in my opinion.
Yeah.
But it was so worth it. Like, I'm so happy because I am like doing Pilates again, and like my body is reacting to it. Whereas before I was working out, doing bar, doing Pilates, I mean, F45 and nothing. Like, I'm like, why am I even doing this? Like my upper abdomen, my lower abdomen, I was like, I'm not seeing results. So after this, I'm like starting to actually see results. I started solid core back, I think at like 4 months, and it's incredible. Like my arms, because I had arm and axillary lipo as well, which I highly recommend. I didn't do that with my first augmentation, and I regretted it. So I'm happy I did it with this, but I am very, very happy, and it's like really worth the pain. And this scar, like the incision, and I wear like, I mean, not like really full coverage bikini. So he does a good job of making sure that with your anatomy that it can be easily covered, so nobody has to see it. So.
Yeah, I think it's a very good point. You know, when you tighten the muscle, sometimes you don't realize because you haven't engaged the core in such a long time that you just take it for granted that it's not there. But if you're focused in helping improve muscle stimulation and contour tightening, I mean, I have seen a number of people they melt away what little bit of fat they had over top of their muscle that we've left behind just because of working out. And that really is, I wish I could take credit for that. That's actually you.
That's what's happening for me. I'm like looking in the mirror, I'm like, I have my abs, like I'm
Wow.
actually getting this back because when I was obviously before kids, I did competitive cheerleading. I was super athletic, and then I had children, and I'm like, oh, it stinks. Like, never gonna look like that again. But he helped, and now I look better.
One is, how long does it take to stand upright?
About a couple hours. So the reason for that, as far as the concern that there is about not being able to stand upright, I think in the past, in the late 80s, early 90s, they were very aggressive in abdominoplasties. They tried to create this flat abdomen. There's nothing flat on your body, so you want to have some level of improvement. I think that it's not the muscle tightening. Sometimes it was the skin tightening because people want this flat skin. But nothing else in your body is like that. So it should match appropriately to the rest of you. So tightening the muscle is important, but it has to be so that you can stand straight. Otherwise, you will have problems. And not being able to walk upright, there's no logic in that process whatsoever. So all my patients are able to walk upright right away. And the goal is to be able, remember, you're going home the same day. You have to go to the bathroom, so you have to get up off the bathroom toilet. You have to be able to do simple activities. I put you in a garment that goes just below the breast line down to the mid-thigh. And it's open crotch. It's not the most attractive outfit, but it's functionally,
It works good.
It works. And it's ideal. You can put your undergarment over top of it. You can wear a loose dress, whatever works for you. But the whole goal is to have convenience when you're doing that.
Another question is, what are your implants?
Well, I mean, so I particularly like subfascial implants. I think that's more of a new change than was before.
That's over the muscle, right?
It's over the muscle, underneath the fascia, and it's a lot of this is based on history of implants. In the 90s, they pulled implants off the market because there was fear of breast cancer associated implants, but that in fact was not the case. Unfortunately, it took 14 years to figure that out. So when they realized that that was the case, they put the implants back onto the market. But for that entire time period, they didn't know how to do breast augmentations. So while in Europe they were still doing augmentations because they weren't following any rules, in the United States it was different. So in the United States, the only thing you could use was saline implants, and you can't put saltwater implants behind the breast tissue. There's a lot of rippling effect that happens, and that became a problem. So they are placed under the muscle for that reason, to augment the breast and make it look good. With silicone implants, they have a very higher level of cohesiveness and they're more firm, but they feel very natural. And putting them in a plane above the muscle without destroying the muscle so that you can do upper body workout, you can have well definition of your pectoralis muscle, and placing it in an area just behind the breast tissue in the fascia helps augment your natural breast by itself, which is the whole purpose behind this. So, I mean, I enjoy using the Motiva implants because they have the lowest capsular contracture rate. They just look better. And this is like an 8th iteration of silicone implants. So
They're great.
you know,
I had is it natural? I had natural before under the muscle, and it like 10 out of 10. But the lift, I think, helped a lot. And I think a lot of people don't understand that.
Yeah, I think you can't just do a lift by itself. In some cases, you can if you're the right size. If you have a C cup, maybe you can get away with it. There are very few people. There are probably about only 5 or 10% of people that just get a lift by themselves and do fine. Most people need some augmentation because most women want to have upper pole fullness in their chest. They're flat here and they're full below. And even if you do a lift, you don't get that upper pole fullness. You get it with compression bras, but you won't get it naturally. So that's where the use of silicone implants is very helpful. And not a lot, big size. They just augment what you need. So the lift is actually, we make an incision in the breast tissue so that we can actually place the implant above the muscle, but behind the fascia itself. And once it's above the muscle and behind the fascia, we then tighten the skin by making an incision around the areola and a little bit to the base. Sort of looks like a little snowman. And the idea is to tighten the deeper tissue, which lifts the breast, and tighten the incision around the nipple and the areola. And it has a very natural look. Initially, it doesn't, but after usually a couple of weeks, when things start to settle and go in a position, they have the position that they need to be in. Because more often than not, especially with breastfeeding and weight changes, the breast itself falls. So the breast in the early ages and then later ages, especially after breastfeeding, there has a significant effect of gravity and laxity because the elasticity that was there to keep the breast tight, that sort of dissipates. So the surgical methodology is a lot better at doing that.
Someone else asked, have you looked at the implant under the muscle given?
Under the muscle? You can. I mean, the problem is that when you're putting it under the muscle, you have to release the muscle. And the idea is to not put too much pressure on the implant itself to get the best results of fullness. If you're trying to get upper pole fullness, then you have to think that the implant has to be going all the way up a little bit higher than the pec muscle. Actually, as we age and you look at yourself, your pec muscle, pectoralis muscle is higher and your breast is lower. So if you're trying to just put it underneath the breast tissue, you'll be flat up top. Make sense? So in that individual, that's where a composite of a mastopexy or a breast lift along with an implant is helpful. But yes, you can put it under the muscle. It's just, I think that the current thought is to try to not destroy the muscle. We've been doing that for a long time, and that was for a different reason. And the studies showed that you can get just as good if you're done safely in an appropriate way, so that you actually have a really good volume enhancement.
You did dual plane, I think, on mine.
Yeah.
I had, like I said, I had under the muscle before. I'll let him explain that.
So a dual plane has been traditionally an implant that you place partially under the muscle and partially under the breast. The problem is when releasing the muscle sort of retracts. So it's no longer dual plane. It actually is just under the breast itself. The idea of, in your particular case, we actually had to bring the muscle down. So we're doing part of it that was under the muscle and close the space so that we can actually give you more fullness. We kind of restore the anatomy itself. And that's what makes the difference. And it's one thing to do somebody who's not had implants before. It's a different challenge when you're doing somebody who already has implants and the different types of implants. And so oftentimes knowing the right size and trying to accommodate for that can be a little bit challenging, because you want to know, you have an idea what you want, but translating that into what does that mean implant wise and lift wise is a little bit challenging, but doable.
What's the difference between people always ask, what profile do you have? What is like high, moderate, low? What does that mean?
So
is that the implant itself?
It's the implant itself. And the reason is almost every group of implants has a very low profile, a mid-sized profile, and a full profile. If you can imagine, it's giving an example of a gummy bear. You have some gummy bears that are really squishy and flat. And you have ones that just are thick and round. And those particular types of full implants is called a full implant, where actually it sits more round and high. But it's usually not very wide. The moderate sized ones can be a little wide. And then the lower ones are kind of wider. And the reason for the different types of implants is based on the different chest wall width. So the breast size is based on the breast width. I'm sure you have people that you know who have implants where the implants are hanging off on the side. Sometimes you can see there when they're in bikinis, and there are different types of tops where the breast is completely shifted to the side. It doesn't look that great to some people. Some people don't mind. But the goal is to try to centralize the implants so they're sitting more here in the chest rather than on the side. And if we can re-centralize that by putting in the right implant in the right place, it makes a difference. When we're undermining that area or going underneath the breast tissue and above the muscle, we want to pick the pocket and put the implant there so it stays there. It doesn't slide all the way back and forth. So if you have a wider chest wall, you tend to use a lower profile, because that lower profile will augment the breast that's already there. People who have smaller breasts, we use more full breast implants, and that's the high profile. And you do that for people, maybe, for instance, younger girls who have an A cup or less than that, and they need more fullness in the upper pole and the actual breast tissue. If you already have a lot of volume, you don't need a really high profile implant. You can get away with what you have, and you just need a moderate size implant. The demis work great for that.
I never knew that. Everyone always asks me, what profile do you have? I'm like, I don't know. They look good.
Basically they're
They look
looking
good.
Yeah, they're wanting to know if you have high profile or low profile. That's all. I mean, I think that the rest of them are small semantics, and they're different types based on the different implant companies. And
So the demi is a high or?
Demi is a medium-sized
Medium.
implant. So what it does for certain people volume, it actually gives you the upper pole fullness that you need.
Got it.
The problem is if you put a high profile in an area where it's very wide, it might be high, but it might be in the wrong place projecting.
Oh, yeah.
So you have that look good so that
Symmetric.
the volume is more symmetric and it's more balanced.
There's a lot of people so I've talked a lot about this on my social media with the standing upright question. I have seen so many people with walkers, they're hunched over. Like you said, you should be able to stand up straight. Everyone was questioning, how are you standing up straight? I'm like, I don't know. I just am. You obviously are in a little bit of pain, so you're kind of like this, but I've seen people that are
Yeah, I
is it
think
because they're scared to stand up, or is it because they're too
I
tired?
think sometimes they can't stand up. I think sometimes the skin removal is a little bit more than you need. I mean, a lot of this is technique and surgical calculation, but you want to have a little bit of a tightness of the incision so that when you're bent slightly up, maybe 20 degrees, it's a little tighter in that area, so that afterwards that will become flatter as you stand up. But you can stand up straight. When we're tightening the muscle, we're tightening it centrally. It's a vertical tightening. It's not a horizontal tightening. That's because of the skin. So
it
if
just
you can't
too much.
stand up, and then of course appropriate pain control. That's important, right? So injecting anesthetic in an area of the muscle, is where you're having the discomfort, is very helpful.
Oh,
And yeah, I mean, and everybody does it differently, right? But I think getting good pain relief without narcotics or lots of narcotics is really helpful. I've been doing this for a long time, and I'm happy with the results that we get with our patients as far as pain.
I know we talked about it, but the Exparel shot. What's your thoughts on it?
So Exparel is a longer-acting marcaine anesthetic, lysosomal, that has been great for many types of procedures. But I think that in abdominoplasties, I have not seen it make much difference. Part of the problem is because it's really meant for skin-bearing activity. So if you have an incision and you put Exparel in the incision, you will feel fine with this, right? You won't have any issues. But to put it in the deeper tissue of the abdomen and expect that to have the numbing effect, so to speak, it's just not panned out. We get the same results with just using regular marcaine and lidocaine. After the first 24 hours, it's sort of a wash. And these are the anesthesiologists who tell us this. They've done their own studies. Yeah, it's not us. I mean, we were happy using it for everybody. I think in oral surgery for people who have wisdom teeth, they do that now. They're not taking any narcotics afterwards. In colorectal surgery, in abdominal surgery, they do that. They inject it, and patients don't need narcotics afterwards. So the pain? Yeah, usually on a scale of 1 to 10, most people have about a 3-4 pain level, and they take some first or second day of maybe Percocet or Lortab, and some people don't take anything because they're still numb in that area and it's not causing them a problem. The first 2 or 3 days, I think, is the most difficult. Not necessarily the first day, it's the second, third, maybe fourth day. And for most patients, they take a couple of narcotic tablets, but you worry about constipation, so we start you on prune juice or some kind of stool softener so you don't get constipated, and you're up moving right away. So that's...
A lot of surgeries these days, they're using nerve block. I don't know.
So yeah, the problem with the nerve block is that that's exactly what we're talking about by Exparel. We've done that in the past. It just helps you for the first day. It's not really doing anything long term. And so you can put a device where you're injecting and you leave it so that it continuously does a pump. But the problem with that is that's above the area where you need to be. It's not in the area that you need to put it at. That's behind the muscle.
Effective, is it?
So placement is important. So
I had my toe surgery. The nerve block worked for like a few days, which was amazing. I had 0 pain.
yeah, no, I mean, we do nerve blocks for almost everything. I mean, even for facelifts, breast enhancement, breast reductions, tummy tucks. We try to inject everywhere we can with anesthetics that will give you the relief that you need. That's extremely helpful, and that goes a long way.
Yeah.
So using a compendium of all these things makes a huge difference in recovery too.
I think it just depends on you too. Everybody's so different. Your pain tolerance, pain level. If you have the abdomen repair, if you don't have the abdomen repair, everybody's
different. I have many patients who are just they've had three kids, and they did well in the C-section. They recovered nicely, and their attitude has been, I'm good. I don't need anything. And believe it or not, they take Tylenol only. Obviously sore and uncomfortable. I mean, nobody wants that, but everybody's different.
It's not me.
Yeah, no, I mean, everybody's different.
Everybody's so, like, literally so different. You can't compare yourself to anybody. You just have to be happy with what you see in the mirror and your pain.
Oh yeah, absolutely.
So it's worth it. I would do it if I were you.
I think it's probably. I remember the American Society of Plastic Surgeons had a review many years ago that 2 surgeries that most people in the United States find as life-changing and life-altering is tummy tucks and breast reduction surgery. And for an interesting reason. Number one, the back pain they have from large breasts and the heaviness. And the second is from the belly itself. Because if your abdomen sits out a lot, that actually has its own challenge also. And usually what happens is, because of the abdomen sticking out further, the back has a lot of lordosis and it lurches forward. So people have a lot of back pain because of that. So tightening the abdominal muscles actually helps correct your spine by tightening it up. So you're actually not slouched, you're actually standing straight. And when you're sitting straight because it's tight, it actually helps your low back problem. And actually there was a paper published, I think in 2006 or 8, I think around that time. I actually didn't know about it. One of my patients brought the article from my own journal and says, see, it makes back pain better. And it was 8 patients, and we did her tummy tuck because she was quoting the paper and it worked for her. Her low back pain and issues that she had helped. I don't think anything takes away back pain, but it helps that area. Any other questions? Your experience, that's also, I mean, I got to see you quite a bit, but how was your experience overall?
It was really good. I mean, from like first meeting him, she was asking me how I chose you. And I was like, well, I did not look at a lot of plastics. I didn't look at any other plastic surgery offices. I mean, online I did, but I didn't see anybody else in person. I'm a pretty, impulsive person. But if you look at, like, if I get a good feel from you and we have a good conversation, what I liked about you is that you didn't push things that I did not need. I said I wanted a blepharoplasty, which is like eyelid surgery, and plus a mommy makeover. He goes, I'm not gonna do that. So that's off the table right now. So I appreciate that, because I feel like a lot of surgeons would be like, yeah, no, let's do it all and let's get it done. And then I appreciate my abdominoplasty. You didn't like do more than what was necessary. So I had the modified abdominoplasty, and he explained to me why I was very like confused. Why? I'm like, wait, why didn't I get a new belly button? He's like, you didn't need it. I didn't need to do that. Whereas I feel like some surgeons would have just like.
Yeah, I mean, that's
like your conservative approach. This is what I appreciate.
Well, I mean, you have to do what's right for every individual patient is different. I mean, it's nice to say that, oh, cookie cutter surgery. It's not that way. It'd be nice if it was. It'd make things really easy. But that's the beauty of aesthetics and plastic surgery, is to be able to sort of title in what you need for every individual is different. Some people have lines in certain areas that others don't have. Some people have weakness in the muscle wall that others don't have. And I think that was probably the best thing for you.
Yeah. I'm so happy, literally. Like mentally, I love what I see in the mirror. It is, we decided we weren't going to have any more kids. And I was like, I'm going to go get a mommy makeover consultation to my husband. He's like, you won't. And I was like, I'm making an appointment tomorrow. And then we got on the books, and they have been wonderful every step of the way, literally. The PAs are great. The staff is great. It was seamless. It was nice. I know you like kind of had concerns about it not being in the hospital. And like he said, it depends on the case, but it was really nice to go to the surgical center and it not be this huge production, because it's just you and they're focused on you. They're not trying to rush you in and out. So, and it's all hands on deck. It was the snowstorm when I had my surgery, and they pulled through. Because I was so worried. I was like, my husband was shoveling. I'm like, I will be getting this tummy. So you better get there.
That's right. I forgot about that.
Oh, yeah. I was first thing.
We weren't going to be there.
I was like,
be there.
Adam, they're not going to be there. There's no way. There's no way. And if I couldn't have done it then, I was going to have to push it to the fall because of personal reasons. So I was like, so they pulled through, and they always will. So I'm very happy. You guys are wonderful, and he's a great doctor, surgeon,
Oh, thank you.
and a great dad too.
Yep.
A great dad. His what? You said your daughter's getting engaged.
One's getting engaged in 48 hours. I was a little late because I had the honeydew list. It was very long. I think everybody's adding on to the honeydew list for me, but
Oh, for you?
huh? Yeah, she knows.
Oh, she knows?
Yeah. She already got asked. This is the actual party for it. If there's a lot of other people, it's the engagement party, not the actual.
Oh.
That's already happened.
Oh.
She said yes.
Okay. Oh, so it's a party.
It's a party.
I was like, I wondered.
It wouldn't be the first time my kids find out things from me.
Oh, that's so exciting.
Yeah.
Congratulations.
Well, thanks.
You should absolutely do it for yourself because you deserve it. You had 3 children. So I tell everybody that if you are able to do it, I feel like everybody deserves to have this done. Not everybody can afford it, but if you can, then it's really awesome. And you'll be really happy. No regrets. 0.
Yeah.
Maybe a few regrets the first 4 days. But then
yeah, I think
the swelling is a little hard.
You have to acclimatize to some body changes because a lot of the changes that happen in anybody's body takes a while. It takes about 3 months for tissue to maximally heal and allow for blood flow to heal across the areas of the incisions. That's the first thing. Functionally, that doesn't mean that you can't do anything for 3 months. It just means that you will see a little bit of swelling in certain areas more in one area than the other because the healing still has to happen completely, not just at the level of the skin, but all the way down. And so that takes a little bit of time.
That was a hard part. That was probably the 2 hardest things was the first 4 days and then the mental battle of the swelling and looking in the mirror and being like, I'm still swollen months later. But like he said, your lymphatic system has to build new channels because they destroyed it. So the fluid holds in the pocket right here. And you're like, wait a minute, I had a tummy tuck. Why do I look like this? When I am almost 6 months and I looked in the mirror 2 days ago and I was like, oh my God, I think it's almost gone. Like all the swelling. So it takes a long time. So that was a big challenge for me mentally. And I think I was in the office more than I needed to be because of it. So
Well, we enjoyed seeing you.
I'm a good time.
Yeah. I think a lot of it is appreciating and understanding that it takes time for things to heal. And when it does, it's perfect. And it almost does. It's just that time of protraction can be significant. If you're doing a lot of liposuction and abdominal tightening, it takes a little bit longer. If you're some people have very thin skin. They don't have a lot of fat. Their recovery is a lot easier. That area doesn't have to reconnect quickly. Usually it doesn't take more than 2 to 3 months. And some people, if you have a little bit more tissue fluid in that area, it takes about 4 or 5 months. But it does get better. It just, timing is sometimes a little bit off.
It takes time, but it's worth it.
Yeah.
It's the only thing is everyone says surgery.
Well, I mean, it's this, but you're not doing it for them. You're doing things for yourself. That's why being able to ask all the right questions, see all the right people, and learn from that is the way to do it. Sometimes I think about kids. After you have the first one, you wonder, why should we have more?
Yeah.
But we do.
Yeah. Yeah. You have to do it for you.
Yeah, you have to do it for yourself. That's the most important thing.
And that's what I did it for, was me. I didn't do it for anybody else. I mean, my family even was like, you're nuts. You're crazy. Why are you doing this? You're beautiful the way that you are. And I said, that's great. Well, you're not me. And you don't see what I see in a mirror. And this is what I want to do because I'm done having kids. And if you're not going to be nice about it, then I'm not going to talk about it. You know what I mean? Just don't talk about it to people that don't agree with you. You don't have to agree with me. It's my body. And then, yeah. I mean, and the risk. There's risk in everything. There's risk in driving, flying. And if it's an elective procedure, and like you said, you're the right patient, then the risks are relatively low. I don't think you would take somebody in those high risk.
No. I mean, it's just I did surgery before I did plastic surgery.
You did trauma, right?
Yeah, I did trauma, reconstructive, and you have to make decisions about people's well-being. It's not just about surgical procedure. That's what I do. But you have to see the whole picture. I mean, some people who have other underlying problems aren't good risks. Not point taking risks for surgery. There are people who have blood clotting disorders, and while I say yes, you can, there are ways of doing the surgery. I would tell you don't do the surgery. There's no reason to do it. If there's any risk that's more than you need, just because you can do it, and it's not like throwing dice and hoping that it lands on a number. I mean, this is knowledgeable information that we have. So if you're at high risk, you shouldn't have surgery. That's simple. If you have all the boxes that you need checked, where you're healthy, you're active, then you're available and you have some family support for it, then yes, you do this surgery. Absolutely.
And what's the nature of
We just have to be healthy. I think some of the bigger challenges people are worried, will I gain fat after we've had liposuction? Well, you can. Most people who do this never want to gain weight. They want to look good, right? And when you want to look good, you want to continue that process and exercise and taking care of yourself. A lot of the mommy makeover issue is not you're trying to look better for someone else, you're trying to look better for yourself. You're doing things to help improve your body contour, and working out after that is equally important. Working with a trainer, helping improve muscle core training and strengthening is absolutely on you, and you want to do that.
Yeah, because I think anybody can gain weight again. Like, it's just the human anatomy, but you don't have to do hardcore exercise after and go to like the hardest Pilates class of your life. I think if you walk, you eat healthy, and you do some strength training, I think you're going to be happy with the results, and you'll start to see your body transform even more, because like you said, they've kind of done the inner work, and now you have to do the rest of the work.
Yep.
Yeah. Yeah.
Okay.
Wait, hold on. Wait. I want to give me a second because I want to download it after. I can.
Party of one. Very nice meeting you. How's your foot doing?
it's doing better.